Hello dear patients, today we are going to review the case of edema of urethra, reddening of urethra, swelling of urethra in a patient. A patient came to us with a clinical picture that you can see on the photo. He had edema, swelling of urethra, with some reddening that bothered him externally. However, there were no significant discharges. These aggravations bothered him even before. He has a constant sexual partner, and there were no other external rashes apart from this symptom. So we took analysis for sexually transmitted infections. We took bacterial culture test from urethra, smear test for inflammation, and as a result of that, it was found that leukocytes were 10 to 20 within a visual field. Bacterial culture test showed a normal flora. As for sexually transmitted infections, herpes of second type, or herpes genitalis, was found, and chlamydia was found. So this clinical picture is due to this clinical picture. So blood was taken for chlamydia, blood analysis for herpes genitalis, and as a result of that, antibodies for all types were found, for herpes genitalis and for chlamydia. For chlamydia, immunoglobulin M was negative, and immunoglobulins A and G were positive. This indicates a chronic chlamydiosis in this patient, and secondly, it indicates herpetic urethritis. So we had to treat both of these diseases, and considering that chlamydiosis was chronic, an ultrasound study of prostate was done, as it is often affected during such infection. However, it was normal. So a classic course of chlamydiosis and herpes treatment was done. For treatment of herpes later on, antibiotic therapy, washing and longidasa, this is what is commonly used for treatment of chlamydia, immunogram was done, and an immune correction in a volume that was required for this particular patient. That is, during treatment of this patient with two diseases, first of all, aggravation of herpes is suppressed by usual tablets like Valvir, Valtrex, Flamvir in order to suppress the process. Chlamydia are also treated in a full scale with instillations, injections of longidasa, immune medications, antibiotics that are required. Later on, after such therapy, stimulation of immunity is done in order to prevent herpes from getting into a chronic stage, not to let it aggravate. In the end, after a long time, anti-herpetic vaccine was used for this patient. So, that kind of multi-step treatment was done, and it led to a complete healing and absence of herpes genitalis relapses in this patient. If it is necessary to diagnose and treat any infections and changes in the area of sexual organs, you can consult the neurologists and urologists of our paid medical center of Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such infections. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.